I have been involved with this great agency off and on and in board service for 25 years. I have also been an agency volunteer. And of course, I am a champion for Family and Children Service and its mission to connect individuals and families to hope, to healing, and to one another. FNCS has been providing mental health and counseling services, case management, adoption support, in-school programs, and more to our Nashville community for over 80 years. Our home is the Honey Alexander Center, but we are also partnering with more than 20 other agencies working out of their spaces to strengthen their efforts and be truly accessible to our clients. And of course, post-pandemic, we can provide most all of our services virtually.
In Tennessee, there are more than 70,000 children being raised by relatives, primarily grandparents. These children would most likely be in foster care if these grandmas and grandpas had not stepped up. In most cases, the children's parents are unable to care for them due to substance abuse, incarcerations, and sometimes even death. The Family and Children Service Relative Caregiver Program supports about 1,000 caregivers and children in 2 counties in Middle Tennessee. Our counseling services, case management, and financial assistance help these grandparents keep their children in their home and out of foster care.
Miss Williams from Nashville is one caregiver that comes to mind when I think of RCP. She stepped in to care for her 3 grandchildren, Renee, Marcus, and Jessica. The children stayed out of foster care because Miss Williams was willing to step in. And when she first got custody of her grandchildren, she lost her job because she was unable to work long hours. Family and Children Service has provided support to the family by providing financial assistance, material assistance, and housing. I've been fortunate enough to work with Miss Williams over the past 10 months. And throughout the 10 months, I've seen Miss Williams' love and compassion that she has for her grandchildren.
More than 13% of families in Tennessee live in poverty. And we know that ways out of poverty and ways to break cycles of poverty include vocational opportunities, education, and family stability. Family and Children's Service partners with the Tennessee Department of Human Services and other nonprofits like Goodwill of Middle Tennessee, Tennessee Voices for Children, Catholic Charities, and many more to assure a network of services including mental health counseling, vocational training, educational advocacy, case management, and more, support every member of the families we serve to change their odds. Family and Children's Service is the convening partner in these programs, and we provide funding to many of our partners to increase their capacity and the strength of our collaboration. And we are the main providers of counseling and case management for the mothers, fathers, and children we serve. Most often, we do this work co-located with partner agencies across over 25 counties in Middle Tennessee.
KJ was a single mom of 3 residing at a local shelter when she started the TANF program. So she mentioned struggling with organization, time management, and other activities of daily living, which made it difficult for her to maintain stability. As the Family Focused Solutions counselor, I was able to provide one-on-one counseling and case management to help her address her mental health needs, build executive functioning skills, all while collaborating with other agencies like legal aid, Medicaid alternative pathways to independence in order to explore additional benefits, supports that she may be eligible for. By the time our services ended, KJ obtained housing, established a routine and structure that fit her family's needs, and expressed feeling like she had a community of support nearby her. So by offering a consistent touch point for KJ, we were able to achieve outcomes that offered her stability, community integration, and a greater hope that her goals are never out of reach.
Metro Nashville Public Schools realizes that its responsibilities to children and families far exceed providing just a quality education. There is an awareness that the whole child and whole community must be supported and engaged. More than 41% of children in Metro Nashville Public Schools have family incomes low enough to qualify them for free or reduced lunch. More than 35% of the 80,000 students served do not know English as their primary language, and many more parents are not even fluent in English. The Community Schools Initiative is funded through Metro Nashville Public Schools to create enhanced supports in over 20 elementary, middle, and high schools across Nashville. This is a combined effort between Metro Nashville Public Schools, community in schools, and family and children's service. At Smith Springs Elementary School, I serve as the community school coordinator. I work to serve and support students, family, and staff in a litany of different ways. I work closely with the admin team and principal, PTO, and other school support organizations. A lot of my job is around resource acquisition, making sure we have all needed resources in the building to make sure students and staff thrive. I think my favorite probably part of my job is the food. I work with Second Harvest Food Bank and the Bridge Ministries to make sure all of our students are fed and can at least approach a minimum of 3 meals a day. I love working in my school, and I love serving the students and families out in Antioch where my school is. Healthcare coverage is a challenge for many Tennesseans. While some of our most needy citizens qualify for TennCare and Cover Kids, others find themselves not eligible but may be able to purchase plans through the Affordable Care Act federal marketplace. Still others are not eligible at all for coverage. The Healthcare Access Program at Family and Children's Service is a federally and philanthropically funded effort to ensure that all Tennesseans have access to federally provided coverage, private insurance, or charity care to support all people into healthcare homes. We provide outreach and education and enrollment supports in all 95 Tennessee counties with staff located across the state.
This job allows me to shine. It allows me to serve. It allows me to help. It allows me to inspire, nurture, and encourage everybody that I come in contact with. Like the disabled grandmother who lost her TennCare benefits because she didn't turn in the proper paperwork. That meant that $175 of her Social Security check would be totally gone. That would have been a hardship. So she called Get Covered Tennessee, and I was the one assigned to assist her. I was able to get her TennCare benefits reinstated. She was able to continue seeing her doctors, getting her medications, getting her diabetic supplies. She was then able to take custody of her granddaughters, and they did not have their TennCare records. They did not have their TennCare cards. They were in jeopardy of losing their TennCare. She called me back, and I was able to get them reinstated as well. So that's why I love this job.
Mental health crisis can occur anytime, anywhere. Family and Children's Service operates Middle Tennessee's primary crisis line, answering more than 40,000 calls annually. As the country is embracing a national network of crisis lines, we are partnering with the 988 Lifeline program as well. Our calls range from situational sadness or frustration to trying to exit domestic violence relationships, child abuse, depression, and suicidal and even homicidal thoughts.
The caller's name was Nancy. She had lost her son to suicide a couple months ago and just needed to talk and express herself. And we did some debriefing. We created a safety plan. And I wanted to assure her that after our call, I was going to follow up with our counseling program and offer her a referral for counseling. I also told her about a program that we have here called Survivors of Suicide Loss. And this is a program where people can come together and talk about their emotions, talk about their feelings, and learn from one another. After 8 months, Nancy's been involved in the program. She's learned a lot about herself, and she's gaining that courage that she needs to be able to move forward. It brings a warm feeling to my heart knowing that we were able to connect and make a difference.
Most recent data indicates that 20% of the community struggles with some form of mental illness, with about 8% struggling with major depression and anxiety. Mental health concerns can impact all parts of a person's life, including parenting, socialization, employment, and education. If unaddressed, mental health concerns can be extreme, resulting in harmful behaviors to self or others. Mental health can be further impacted by substance use and abuse, and many mental health issues arise due to trauma and abuse.
Family and Children's Services provides individual, couples, family, and group therapy services to meet an array of mental health needs. We realize that trauma, losses, domestic violence, and other kinds of abuse affect our clients in a deep way and create challenges for them in every aspect of their lives. The work that we do with the families, and particularly with the parents to support their children, ensures to foster resiliency for them. Clinical services are at the core of what we do here at Family and Children Services, and they are present in every single program that we offer to the community. I am proud to be part of the counseling program here at Family and Children Services. This is the oldest counseling program in the city of Nashville.
In a nutshell, it is really a challenge to describe all of the work that FNCS does and the impact that we have on the community. Basically, Family and Children Service provides a lot of different kinds of support in a lot of different ways, in a lot of different places, to a lot of different people.